When we talk about cancer, we often think of it as a disease, but fundamentally, cancer is a cellular malfunction. It happens when normal cells in the body begin to grow and divide abnormally and uncontrollably. But what causes this transformation? Why do healthy cells suddenly stop following the rules? At the center of it all is damage to DNA, the genetic blueprint that tells our cells how to function, when to divide, and when to die. When DNA is altered or mutated, those instructions can become corrupted. The cell may lose control over its growth, ignore signals to stop dividing, or fail to die when it should. These mutations can accumulate over time and lead to cancerous growth. Let's explore what can cause normal cells to begin growing abnormally. First, there are carcinogens. These are substances known to directly damage DNA. Tobacco smoke is one of the most potent and well-studied examples, containing over 70 known carcinogens. When inhaled, these chemicals can penetrate deep into lung tissue, where they interact with cellular DNA. Over time, the damage can overwhelm the body's repair mechanisms. Similarly, exposure to industrial chemicals, air pollution, and even processed meats introduces carcinogens into the body that can increase the risk of various cancers. Next, radiation. Ultraviolet UV radiation from the sun is a major cause of skin cancer. It causes DNA mutations by creating abnormal chemical bonds between adjacent DNA bases. This distorts the DNA structure and interferes with replication. Ionizing radiation, like that from X rays or radioactive substances, can penetrate deeper and cause more extensive damage to DNA, including breaks in both strands of the DNA helix. Infections also play a significant role. Certain viruses integrate into the host's DNA and disrupt normal cell functions. Human papillomavirus, HPV, can inactivate tumor suppressor genes, while hepatitis B and C viruses can induce chronic liver inflammation, leading to liver cancer. The bacterium Helicobacter pylori creates a long-lasting inflammatory environment in the stomach lining, contributing to stomach cancer. Hormones can also fuel abnormal growth. Estrogen, for example, can promote the growth of some breast cancers by binding to estrogen receptors in the cells and stimulating proliferation. Long-term